Hi, and welcome back to the Entangled Health Podcast. We're here to explore complex and relational work of building trust, better health, and justice through storytelling and strategy based on that storytelling. And so today I wanted to talk about, like what an organization, what your organization looks like before implementing storytelling as infrastructure versus like what it looks like after. I think so often it can be really hard to conceptualize, like, what will that change actually be? And, we get told about so many, like, this is the one good big thing, and this is no, 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 this is the one big good thing. And so I think that it's important to have a tangible sort of portrait painted of what it can look like before and what it looks like after. And so often the clients I work with assume that stories are, something that you collect for a report or a campaign as a one-off thing. But what I've seen over and over again, once I work with folks and once I work with the Center for Story and Strategy, is that when stories become the backbone of how we listen and design and relate to community, truly everything within the organization shifts, and it shifts towards more impact, more sustainability, more efficiency with resources, and all of these magical things that our bosses ask us to attain each day become really sort of easeful and in like put into a process. And so, this matters because when we have one tool that can lead to increased health seeking behavior and stronger program impact, staff retention, patient provider connection, and flows of funding, we realize that storytelling isn't fluff, and it creates and leads to these real system level outcomes that we all deeply crave in the work that we do because we care about the communities who we're responsible for serving, and that really matters. And so I'll give an example at the end, but I also just wanted to jump in here and say before we get into this portrait painting of the before and after that through the end of the year, I have two more spots available for Story Lab sessions. And as you maybe know, Story Lab sessions are where we sit down for 2 to 3 hours, and I promise it's worth it to spend that much time together and really get to the bottom of like where things are now, what needs to shift, where the possibilities are, where your current operations have opportunities for weaving in storytelling, so that we can really create a strategy for you that isn't based on, oh, that would be nice if, but is really based on the team you have, the strengths you have, the opportunities you have, and really start that process of embedding storytelling into your organizational culture so that you can have this beautiful these shifts that we're going to talk about in the after chunk of this podcast recording, and all of these, impacts for your patients, for your providers, for your whole teams, for your comms team, your advocacy team, your fundraising team, all of the above. So if you want to spend a couple hours together setting you up for 2026, I can't think of a better way to spend a little bit of time setting yourself up so you're going into 2026 with programs that are going to be more impactful and this ripple effect of having everything based on and a lot based on and actions based on the expressed wisdom and needs of your community as well as your teams, your organization, and that all starts with a session there. So we'd love to spend that time together with you. Do reach out. I've got my contact information in the show notes if you want to snag one of those last slots, and we can spend that time together and set you up for 2026 so that you don't get partway through the year and wonder, oh shoot, like what if we had had a plan for this? How could we have built this into the plan? So I've got you there. Come on down, and we'll get it. We'll spend some time together and get it all straightened away. So into um the meat of this episode. So first we're going to talk about the before moment, right? Before always comes before after. So in before, there's a couple of different really big, six mostly, like really big things that stand out when I see organizations that haven't quite implemented or integrated storytelling, innovation, and implementation. So the first is that So often then their programs are built on assumptions and not lived experience. So they've put a lot of time and energy and resources into having these beautifully built programs, but they haven't spoken to the communities who might access those programs to see, like what are the access needs that they have, in terms of timing, in terms of what they really need and want when they are deciding whether or not to attend programming, things like that. So when this decision making is top down, it really disconnects from community realities. And then we've spent all this time and energy and effort on these programs that nobody's coming to, and our staff is frustrated, and our funding body is frustrated, not knowing you know, why we're spending this money to do this thing and no one's coming. Whereas when we spend some time listening and strategizing before we build programs, we can build them in another way, and I'll talk about that in the next session. So the next really big before state that I see is having like low trust and weak engagement. So again, it's that sort of we can't get people to participate. Folks aren't coming in for preventative care, or if you're not a hospital, but you're a not a hospital or health center, but you're, say, like an organization that provides other services, say a nonprofit or something like that. You see this sort of lack of engagement in the work that you're doing, and that there's community members out there that you really want to be serving, and you're just not quite sure how to reach them or engage them or activate them. And this is often because, our messaging doesn't resonate. We're not building trust through communications. And it's just this sense of like, I don't know why I'd go there. It doesn't seem any different from any of the other places that have broken trust in the past. Another thing I see, which we're seeing in so many arenas right now, is high staff burnout and turnover. So often in health and justice organizations, people come to the work because they feel enlivened by the mission, and because they really are there to care for people and serve others. And when we aren't connecting with our communities and building trust with our community, thus not really serving our community, the people with the best intentions who come to the work with so much heart and so much goodwill and so much drive to really change how things are, panning out for the communities they serve, they get sort of disillusioned in this feeling of like, well, does it even matter what I do? And that can be really disheartening. And of course, also there's a huge, huge issue, with the bottom line there too. When we have staff burnout and turnover, we're just, all know the expenses of onboarding and recruiting and all of that, as well as, losing all of that institutional knowledge when people are frustrated and they leave because they don't feel like they can make the impact that they really came to make. And another thing I see in this before world, before storytelling, is that patients and providers, they feel like they're in separate worlds. The communication is transactional. Intake forms are really get in the way of relationship building. And of course, we need paperwork and intake forms and all of these tools. But there are ways that small storytelling tweaks and intervention can really, I've seen in work with clients, increase patient provider satisfaction. And in both cases, so the patient and providers can really feel more connected to who they're sitting across from, and we all know, right, the incredible strains on provider time and what that causes. And so our real job and goal there then is to to have these ways where we're not asking for more time from providers, but we can find ways to reach them. One client that I worked with was a large hospital system. And what we did is we just had the set of questions, and patients could choose one, patients especially that had like complex health needs, and they could just choose one, and that went into their chart. And then their the providers on the way to the room could listen to that and just have a better sense of who they're sitting across from and who this person is and what motivates their health journey and things like that. And so it's really those small tweaks or, adding patient story into grand rounds and just all these other places where you already have the infrastructure. But we'll get to that. I always get ahead of myself and go more into the, what's possible while trying to paint this picture because I think I just get so frustrated that it's like, it doesn't have to be like this, right? There are really easeful and impactful ways that we can, break through this sort of monotonous wheel of feeling stuck in what we're doing and what we're providing and who's providing it. And then another of the before scenes I want to paint is the communications picture. Our communications teams are working so hard and doing so much, and they also are in many ways, tied to, um, they have a certain brand that they need to uphold, and all of that's really important. But there's this desire and need for story, and so there's this sense of scrambling for stories and calling on the same usual suspects over and over again, and really missing the opportunity to have that robust bank of stories that can be used for all sorts of initiatives, which we'll go into soon. And everything just feels a little bit one off and extractive and rushed, and patients aren't seeing themselves, or if you're in more of the nonprofit scene, the folks who you serve aren't seeing themselves in your communications and don't really feel like it reflects them back to them, which, as we know, when we're trying to bring people in and build that trust, they need to see themselves in the communications that we put out. And then finally, if you're an organization that goes out for funding, we see so often that funders don't clearly see the impact without storytelling. So without that narrative depth, our outcomes look really technical and they look really like, and of course, numbers and data are important, but it looks really like technical rather than transformational. And there isn't that deeper impact statement and that what sets you apart from the other many organizations they fund, and what sets you apart and makes them want to give to you specifically and really like bet on your mission. And we when we don't have storytelling woven in, we just don't get seen by funders in the same way, funders and donors. And this is true even for grant applications and reports. Like if we don't have that clear depth, then we just miss the opportunity over and over to connect with funders and get to what they really care about, which is the people that their donation or grant or funding is going to impact. So those are the six main things that I see so often in the before state. So again, it's those programs built on assumptions rather than lived experience. It's low trust and weak engagement, staff burnout and turnover, patients and provider feeling like they're in separate worlds, communications efforts that feel really reactive and thin, and then funders not seeing the impact clearly. So let's go to the after, right? Like this, like I wish I could play a little like chime sound of like, like a magical thing that happens because it seems like magic, but it's not magic. It's just like really strategic, often low lift tweaks that bring, all of this to turn it around a little bit. So the first thing we see in that after state once storytelling becomes infrastructure is we see health seeking behaviors increase. Our outreach efforts and become like more relational and resonant. People start to see the people in their community who they really trust or somebody with a similar story to them who, chose to access a your services and the impact that made. And then it's like, oh, well, maybe I should do that too. And so when people feel seen or reflected to, like we talked about that in the last section, like in order for people and community members to want to access the services that we have. We can have the best services in the world, but no one's going to want to come to them if someone they trust isn't also doing that, or somebody who, or if we're not making an effort to build trust through sharing story and showing like the real world impact of our work. We live in a low trust environment across so many uh, sectors and just like across the world in general. And so our job then is to build that trust through sharing the stories of who is impacted by work, who is accessing it, and how we can continue those health seeking behavior increases by showing people, you know, the stories of people who are also impacted by the work we do. the next change I really see when I work with clients and they, implement storytelling infrastructure is that their programs start to deepen in effectiveness. And so, when we listen to our communities, like, okay, so say you have an intervention that or a program and you get that like 42% of people who are eligible for it or who you really wanted to join it are joining it. That's fantastic. Like 42 is great. And then when you take a moment to speak to the people who aren't, who, would be your like ideal clients and the ideal patients and and the ideal people to access these programs, when you take the time to listen to them, to that other, I forget what I said, I think 42, so 58%, um, you start to see, oh, like what are the, like maybe it's that like if the time were a half an hour different, many more people would be able to come. Or, if you also offered X, Y, or Z, many more people would come. And you start to see this nuance of what people are really asking for. And it isn't that you need to like completely overhaul everything that you've done and work so hard to build. It's just that you get to make these small tweaks based on community input to make it a program that they actually want to seek. And so we change from this like sense of like us telling people what they need to people telling us what they need and how we can support them in that. And that's a huge difference. And like all of us in our daily lives, like I certainly wouldn't go somewhere where somebody just like without asking me what my priorities were, what my schedule looked like, what my life looked like, telling me like in order to be well or to get what you need to do this. I would be like, you have no idea who I am. And I imagine you'd have a similar reaction. And so then why do we ignore that step when we're creating programs and just get so stuck in different parameters without really seeing the how we can ground things in lived experience and make those small and big changes to really deepen our programmatic effectiveness. The next thing we see is staff retention and satisfaction rise. So, as you know, and as we talked about, like one of the most expensive things that organizations experience is staff turnover. And so, when those staffs with the really big heart and the love of this work and the devotion to this work are able to feel connected to the communities who they signed on and studied for many years to serve, they get to be reconnected with that meaning and purpose. And there's that internal culture shift toward listening and reflection and repair and that bridge sort of between like the work they're doing and the impact it's having when we can hear those stories. So it's not just them listening to the stories as well as us listening to them and basing things off of what we're hearing from staff and just using it. I talk all the time about that like healthy storytelling ecosystem where it's like we listen deeply to staff and the communities we're responsible for serving. We create programs and strategy based off of that. Everyone has buy-in because we've created it from what they've shared. And when you have everyone's buy-in, your impact is so much greater. And when your impact is so much greater, you have so much more to share with funders and boards and everyone celebrating your success. And when everybody's celebrating your success, you can go back and listen about what could make it even better. And because you had buy-in and trust from the last time, you can, even build on that in the next phase and on it goes. And so that staff retention and satisfaction is such a part of that healthy ecosystem as well. And the next is that patient provider relationship strengthens. And I know I touched on this a little bit before, but I worked with that organization that had um their like patients, especially who had complex care needs, answer just one or two questions just an audio and put it into their chart and providers were able to listen to it on the way to the room and the nurses were as well, and everybody was able to just learn a little bit more about this person. And we did some before and after um testing and just found that patients and providers both just felt from that small little 2 minute at most tweak, felt a huge amount of closer tie to their patient and satisfaction overall in their relationship. And that's huge, right? Because any industry we're in, the services that we're providing for caring for folks in any way, be it as a social worker or doctor or nurse or patient navigator or something else in a nonprofit, we just want to know that who we are working on behalf of and what it is that they need and want and how we can contribute to that. Like that's why we all got into this work. And so then the next big change that I see that is huge is, that your organization then gains that evergreen advocacy library. So this is something I work with clients with all the time, and it makes such a big difference is, we do these story drives and we do them really intentionally and we feed people and we build trust and we record long conversations and stories and have people self-submit and things like that. And then we can edit them in all of these different ways. And then suddenly you have this huge bank of stories and insights and quotes that are just endlessly reusable and evergreen. And they can go into your grant reports or grant applications and legislative testimony and through staff onboarding, retreats, campaigns, capital campaigns, communications pushes, like everything. And so it's just a matter of like getting out of that habit of overwhelm of being like, oh, we need stories for this, that, and the other thing, and just having this like real infrastructure built where stories are gathered over time and added to this and archived in a responsible and easy to use way. And so you're not reinventing the wheel every time. These stories just continue and build, and all of your teams, your comms team, your advocacy team, your fundraising team, your programmatic team, all get to pull from them and learn from them and just have that really central bank of like, this is our story. These are the voices who we work for and to and are responsible for. And then finally, those funders start to flock to organizations with community rooted stories. So often now, when I'm working with clients who are going out to philanthropy or applying for grants, like asking for stories is a part of that application or that trust building process. And so you don't want to get into a position where you don't have any of those assets set out and you want to just have again that really healthy bank of stories that you can use and pull from and share. And then also um that like what it does is storytelling and good stories when they can tell that it wasn't just like, oh, you went, and from the one person you always ask stories for and in a rush got the story. When we have robust stories to share with funders, they can see that our communities trust us and that there's that proximity there and that deep listening. And that's what people really want to fund. As I said, we're in a really trust bear environment right now, and trust is really thin. And so when funders can see that our communities trust us and trust the work we do, they're much more willing to sign on and fund the programs that we most want funded because they know that we've listened to our community about what we're funding, and they're not just going to fund something that's going to fall flat in community. So, storytelling is, it ties back to these pillars of the idea that, the namesake of this podcast, that our health is entangled, right? We can't separate out personal with mental from communal and environmental. It's all so entangled and in a really beautiful way and in ways that make it really complex and also really, you know, urgent and important that we tend to everybody's health in a holistic way. And it gets into that, these pillars of interdependence and accountability and that liberatory imagination of stories allowing us to see past the scarcity and into new futures of what's possible when we really listen. And so one example I'll give is I spent some time with a really large hospital system, and they wanted to tell stories of, they're in a really rural area, and they wanted to tell stories of the like rural caring workers. And we use that really broadly because we wanted, it to be, yes, the providers and the social workers, but also the peer recovery coaches and the doulas and the people who fix the cars that provide transportation to the hospital and the people who do home repairs in the community under grants so that people can stay in their home because housing is healthcare. And so we worked to first the Center for Story and Strategy. We designed and provided numerous trainings to the community on the importance of storytelling in rural health and rural caring work and how organizations whose numbers look a lot different, right? Like their numbers don't look like big hospital systems with where they can say, and this program reached thousands of people. Instead, they really need those stories of the ripple effects of their work and what really like how whole communities are changed when large hospital systems in rural areas really pay attention and get creative about, the caring work they do. And so what we did is we recorded after those trainings and after folks were trained and they, during those trainings had some opportunities to try around with a few different formats. We had some recording days where we were there and had almost like a pop-up recording booth and folks from all organizations and all over the area could come in and record their stories. And then I edited them and got them their little short snippets and along with their full long conversation and lists of pull quotes so that they have these assets ready to share out about the real impact of their work. And we've seen so much come back from that. We've seen, grant funding be accepted based on those stories and new relationships forged and new ways of doing things and cross the aisle collaboration. That there's just been, too many examples almost to count of just like that, what that small intervention did and offered to a community who really needed that story infrastructure to be able to share the impact of their work and get more buy-in for the impact so that they continue to do the important work they do in their communities. So anytime you hear storytelling is, an extra or an add-on, just think about this and how it's strategy and it's relational infrastructure and it's something to build on. And I think that, again, as I said at the top of the episode, if your team is feeling that friction of the before phase and you want some support imagining what after could look like, do reach out about a story lab session and we can get really clear on your narrative strategy and the different shifts you want stories to drive. And it's just a few hours together before the close of the year so that you know that 2026 and the years to come are really set up so that you can make the impact you want to make and you can really reduce, it's also that feeling of just like wanting to reduce friction. There's enough of that in the world in 2025 and I'm sure beyond that we really want to think about how to set your team up to have as high of an impact with as little friction as possible because these things don't have to be hard or challenging or a drag. It's so easy to set us up for just that easeful story led like yum, let's do this. We know how to do this. We know our community knows how to do this. Let's ride. So do reach out with any of those questions. And um, yeah, sending you so much care and hoping that you have, some really good food and snacks this week and some really good connections as well. And I will see you next time back here at the Entangled Health Podcast. All right, take good care.